All right. Well, I am Stacy, and I am a registered dietitian, exercise physiologist, and director of Genev's Health Coaching. And I am here today with two guests, which is great. So we have Dr. Rebecca Dunsmore-Sue, who is our Chief Medical Officer, and then also Dr. Laurie Mintz, who is our guest today. So, Becca, can you give us just some background on you and your role with Geneve?
Sure, happy to, Stacy. I am Rebecca Dunsmore-Sue. I'm an obstetrician gynecologist here in Seattle. I'm also a NAM certified menopause practitioner, and I am Chief Medical Officer for Geneve. My main roles are to sort of run our telehealth program, as well as sort of work on our content and make sure that we're always staying medically valid and sort of be the medical eyes on everything we do. And that's basically what I do for Geneve. And I am thrilled that we're doing this webinar format with Dr. Laurie Mintz. She and I have done a podcast together before, but this is really exciting and a really exciting topic. And I'd love it if you could introduce yourself, Laurie.
Sure. Hi, I'm Dr. Laurie Mintz. And before I introduce myself, I will tell you that I am in Gainesville, Florida, where there is a major thunderstorm going on. And I lost power and internet right before we went live. And I connected to my hotspot on my phone. So if I disappear in the middle of this, it's not because I'm not enjoying talking to you all. It's because, and I can see that my face is a little spotty. It's probably due to or a little blurry. So I apologize in advance. So I'm Laurie Mintz, and I have many hats. I am a licensed psychologist in private practice where I see clients for general and sexual issues. I'm a professor at the University of Florida where I teach the psychology of human sexuality to undergrad students. And I'm the author of 2 books, both aimed at empowering women sexually. The first is A Tired Woman's Guide to Passionate Sex, which is really relevant to the topic of menopause. And the second is Becoming Clitorate, Why Orgasm Equality Matters and How to Get It. And so my whole gig is translating scientific information about sex for the public. Thank you.
Sorry, I'm sitting in my office at work, and it turns out I keep this book in my office at work to share with my patients.
Perfect. Right on cue, and not even practiced. Thank you so much, Dr. Mintz, for your introduction, and we are honored to have you. Obviously, you have a great wealth of experience and knowledge, and really excited to have you share that with our audience today. So to start things off, especially working with women during peri and postmenopause, one thing that comes to mind is the commonality between the topic of menopause and sexual function and health. Both are important things for us to know about. Both are natural, and both are topics that are not talked about enough, at least in my opinion, or it's uncomfortable for a lot of women to talk about these things. And now we've added on the COVID-19 piece of things. So we'll kind of get into, how does a pandemic play into this? But I'd love for you to just start off by if there's a definition for sexual health, or what is sexual health and function, just so we know that get our audience on the same page.
What a great question. I love that. And yes, we don't talk about any of this enough. And sexual health is really broad, and it's multifactorial, right? And if we look at it from the most basic perspective, it's not the myth that you hear out there of being always happy with your sex life, always satisfied, always orgasmic. Those things are great, but sexual health is really understanding your body, embracing your body, your sexual body, getting increasingly comfortable and educated about your body, attending to your body's health, and being positive about sexual functioning rather than shameful about it. So it's at its basis, it's attending, just like you would nutritional health, right? Mm-hmm. It's attending to what is good for you, what makes you feel good, what makes you feel happy, what makes you feel empowered. And it's really knowing that sexuality is a fundamental, important part of happiness, well-being. It's a subset. The happier we are sexually, the higher our overall wellness is.
Excellent. Yeah, that's such a great point too. I like how it's a holistic piece, and it's not just one aspect. And I like how you pointed out too on it's not just about being excited or orgasmic or happy all the time with your sex life or your sexual health. There's different spectrums. So I think a lot of women sometimes feel that shame if they aren't happy all the time, and how to work through that.
What I know that I address oftentimes with my patients in clinic is comfort. And you mentioned that, and it's a big portion of it, not just, and some of that is physical comfort, you know, especially in menopause, physical comfort can be challenging. There could be vaginal issues that we have to address, which we can as providers address with you. And there are great solutions to make sex comfortable for women. But also comfort with our bodies and how they change.
Here. Hold on with us.
Uh-oh. Did you lose me?
You're back.
Okay.
Yeah.
I was going to say, I'm on my work internet. It should be fine. I was going to say, so it's not only physical comfort, it's also comfort with our bodies and how they change in menopause, because they change in menopause. It's normal. It's natural. It's going to happen. We will not be 20 forever. That's not a normal thing to be. And learning to be happy and sexual in our new personas, it can be very empowering for some women, but it can be very frightening for others.
Yeah. And
Can I
Dr.
jump in
Mintz,
there?
do you have any thoughts on that?
Yeah, I was just going to say, can I jump in there? So thank you. I mean, I talk to so many women who lament the changes that they're experiencing as they age. You know, I'm no longer as, you know, my vagina is dry, it's painful. And yes, there's ways to deal with that medically, which Dr. Rebecca is an expert on. And I send people to gynecologists all the time for that. But like, we have this myth that we should still, and I talk to clients about this all the time, that we should, like, we accept other changes, maybe some of them harder than other, right? Like, you know, in our bodies, in our life, in our skin, all the things that change as we age. Yet there's this myth out there that sex should stay the same. And it doesn't. It changes along with us. And I, you know, for a lot of people, that means letting go of this ideal myth that you're going to always be like you were when you were 18. And that's false. And it only sets you up for feeling bad. Instead of, I was just talking to a client this morning about creating a new sexuality for your life now. Rather than lamenting what you had. And for, if you embrace that, it can be even better.
Yeah.
In my opinion.
It's that natural tendency for us to always to want what we knew in the past, and it can be hard to imagine something better in the future, but that certainly is a possibility.
Yes. I always have a funny story I tell when I talk about this. I was with a client, a very dear client of an elderly male, and he was lamenting to me that his sex life wasn't what it was when he was younger. And this was he was in his 60s, late 60s, and he had been a college football player, and he was bald. And I mean, I had a long-term relationship with him, which is why I could tease him like this in this affectionate way. This isn't something I do with a brand new client. I said, oh, wow, it's time for the session to end. I think you need to go to football practice, don't you? And he looked at me like I was like, what are you saying? I'm like, yeah, you're the quarterback of the college team. You better get to practice. But, oh, I bet your baldness bothers you. And he just started laughing. And he's like, okay, I get it. I'm okay with not being the quarterback. I'm fine with being bald. And you're saying that I shouldn't expect to act like I'm 18 sexually. And I said, exactly. So.
What a great way to illustrate that point there, that we are dynamic humans and it's normal for these changes to happen.
Absolutely.
Dr. Mintz, have you seen anything with now in a pandemic and the effects on sexual health and function? Has that come into your work at all?
Yes, quite a bit. I think what I've seen, and there's been one study that came out of the Kinsey Institute on this also just recently. So what I've seen is a decrease in sexual interest because people are stressed, and stress has a negative effect on sexual interest. Mm-hmm. And at the same time, I have people saying, I think everybody else is home having lots of sex and lots of fun because that's what other people must be doing, and something's wrong with me. So that's what I've seen a lot. And the study that came out of the Kinsey Institute is that people are less driven towards sex. They have lower sex drive because of the stress, but the sex people are having is tending to be more experimental, which is interesting. That which also explains why vibrator sales are up during the pandemic, which I think is a really good thing, especially for menopausal women. Mm-hmm. So I think that's great. So people are trying new things, but trying new toys. They're having less, but the sex they have is a little more experimental.
Mm-hmm. Actually, that's a great point about the vibrator sales. I many times in my clinic will recommend vibrators or other toys, both to help with sexuality, but also to help explore one's own body. And it can be an uncomfortable topic, but it's a really important one because I think it can be very helpful.
Yeah.
Yeah, thank you for bringing that up because I think, when I'm talking with women on my calls too, the conversation around sexual health and function and making recommendations for some of these things, if they're not comfortable with it, can sometimes be like, ooh, is that something that I want to talk about with you, or where is that? But it is a part of our life and our wellness and quality of life.
Yeah. And back to the vibrators, and Dr. Rebecca, you can probably speak to this. Vulvas, female external genitals, respond very well to vibration. It doesn't mean there's something wrong with your partner. It is just a type of stimulation that our vulvas respond to very, very well. And this has been known for centuries. I don't know if it's true or not, but some say Cleopatra made a clay box and put bees in it and held it to her vulva because it vibrated.
Hopefully they never got out.
I was just going to say, I don't know if we go with the vibrators on the market, not a homemade one right now.
Yes, please.
Yes. But, the research is so clear that women who use vibrators have easier and more frequent orgasms. And sometimes as we age, we need increasingly intense stimulation, the kind that a vibrator can provide.
That's actually a great point, and that's one of the many reasons that I do recommend vibrators, especially as we age. I also recommend it because I feel like, this is a part of the body that stimulating it regularly does lead to good blood flow down there. Mm-hmm. It will keep things healthy and being used. And I agree, the female vulva absolutely responds well to vibration. It responds well to sound waves. And, these things can be used alone or with your partner as part of a sexual encounter if you have a partner, and it can be beneficial in both ways.
Absolutely. And a lot of people think like, oh, if I need a vibrator, well, that means something's wrong with my relationship or my partner. But no, in fact, it can help take the pressure off of your partner because the overwhelming majority of women don't orgasm from penetration. So the vibrator is just a tool to enhance it. I often use the metaphor of a pool. If you go to the pool with your partner and you have a raft in the pool and you jump on the raft, you jump off the raft, and you have a good day swimming and floating and jumping off and on. You don't go home and call your sister or your best friend and say, oh my gosh, my raft and I had so much fun today. Oh, and my husband was there too. You don't even mention the raft. It's just a tool to help the swimming experience, and a vibrator is a tool to help a partnered or solo experience.
That's a great comparison. And a theme that seems to be coming up, it sounds like a lot of women, I'll put myself into this, we're really great at telling ourselves stories in our head about what other women are doing, stories in our head about what this means. If I buy a purchase a vibrator, that means I'm not getting pleasure from my partner. What are your thoughts, Dr. Mintz, on where these stories come from, and maybe the root of them, and how can we start changing that? How can we make this shift and help to empower women to think differently when it comes to sexual health and function?
Yeah, what a great question. If I had a magic wand, and I don't mean the vibrator kind, like the magic one, although they're all kind of magic, I would wish for that. That where do the myths come from? You know, hard to say, and I'm going to say something that might be a little strong for some people, but every time I dig into a myth, it's there. And that is that we undervalue female sexual pleasure and we overvalue male sexual pleasure. And that is behind a lot of this, including the vibrator myth, right? Like, if we need this instead of a penis, there's something wrong with us. You know, or we use the word sex and intercourse as if they're one and the same and relegate everything before that to foreplay. And what most women orgasm during foreplay. So a lot of the myths come back to us believing that we are supposed to have, that our sexuality is supposed to be like men's, and it's not. It's different, but it's not worse, and it shouldn't be held up in comparison. And I think the movies and the media really reflects and does a huge disservice to women in perpetuating all of these myths. That's my take on it anyway.
Yeah, no, I think you're right. We're getting all these messages from so many different ways. You hear a message over and over again. It's easy to believe it's the truth when that may not be the case.
And those messages primarily are written by men.
Yep.
So they just, it's not that they mean to be bad or wrong about it. They just don't, many men are never taught how women's bodies work. Mm-hmm. And so they don't understand why their version of sex is not our version of sex.
Yeah.
And then we don't have sex ed. So where do people learn?
Right.
Where do people learn? They don't learn it at school. They don't learn it from their parents. And sometimes they turn to the internet and get false answers, which is why the work you all are doing is so, oh, look, my picture just came on. Maybe my regular internet came on. Hello, everyone. Now I'm not blurry. But that's why the work that you all do is so wonderful, because you're providing accurate, medically accurate information.
Mm-hmm. Well, it's the first place to start. And I think, their comment about sex ed is great. Even if in places where we do have sex ed, it is so hyper-focused on pregnancy, prevention, or how you get pregnant. When that's, a very important but relatively limited portion of most women's lives.
Yeah.
Absolutely. Yes.
Yeah, that's a good point.
Yes, that is a really good point. And it focuses on the dangers of sex often.
Mm-hmm.
How to not get pregnant, how to not get an STI.
Right.
Rather than, like, nowhere in sex ed in the schools are we ever taught, oh, did you know sex is supposed to be pleasurable? And this is how you make it pleasurable. Like, that's just unheard of.
Well, I think a lot of that is, we see a lot of what we call purity culture in the United States from Puritans, but also religious influence. And while that may be a religious value judgment, it is not a good... It's not a good way to approach sexuality, to make it scary, bad, or not pleasurable. And I don't think it's good even from a religious perspective. Even if within your religion it is reasonable to only have sex within marriage, that sex should also be pleasurable. Mm-hmm. That's what keeps a relationship together.
Yeah. Absolutely. Absolutely. And it's hard to go from being told sex is bad until you're married and then have it be, oh, flip that switch, now it's fun and pleasurable. Right. We humans don't work that way. No. So it presents a lot of challenges for people to overcome that sex negative messages.
Yeah.
Yeah. No, and that comes back to the shame and the guilt, Dr. Mintz, that you talked about some women experiencing. And I've talked with women too that have that same type of shame and guilt, especially during menopause, when things are changing. All of a sudden they feel like I'm doing something wrong. My body's changing. It's my fault that I'm not able to have sexual intercourse the same way with my partner anymore. Do you have, both Dr. Dunsmore-Sue and Dr. Mintz, any thoughts on that, especially when it comes to women in menopause and how to shift those shameful thoughts, or where that could be helpful?
I'm going to let you start, Laurie.
Oh, okay. I was going to say, I'll let you start. I think I think really educating people, there's women, that there's nothing wrong with you when, and again, I am not a doctor, so I have just enough knowledge to say this, and if I'm wrong, you'll correct me. As we hit menopause, we have less estrogen, and estrogen is responsible for vaginal lubrication and elasticity. And so, of course, it's not that you're doing something wrong, it's that your body has gone through menopause. And there are things your doctor can help you with, there's things you can do, and there's different ways to interact sexually as well. But the most important thing is to know that this is it is a normal biological change. And I've talked to so many women who are having painful intercourse, or they're either stopped having intercourse because it's painful, or worse yet, they're pretending it's not painful and it is, and they're not saying anything because they think something's wrong. And what enormous relief they hear when I'm like, well, that's a biological change. Mm-hmm. It's got a name, that go see your gynecologist, because she or he can prescribe things to help you with that. So to me, it goes back to having accurate information about your body and the changes.
That's absolutely true. It is a totally normal change. As estrogen levels go down, the tissues of the vagina change, and the lubrication, the elasticity, the collagen, even the thickness of the vaginal walls changes. For 50% of women, that causes absolutely no symptoms. And for the other 50%, it can actually be very devastating. Like you said, it can make sex unbearable. And some people actually grit their teeth and bear with it. And that's absolutely the wrong move to make, because we can make it better. There's a whole spectrum of things that we as gynecologists do, including moisturizers, lubricants, sometimes vaginal estrogen, other modalities that we can use to help make that comfortable again. Mm-hmm. And oftentimes we even include pelvic floor physical therapy, because when something's been painful for a long time, you close up that pelvic floor so that nothing gets in there, and that can make sex in and of itself painful. And the last thing, this brings us back to the vibrators. Sometimes, because lubrication can be a little more challenging to achieve for women in menopause, I recommend that you start the sexual encounter with a vibrator, because if you're already very excited when you go to have intercourse, the lubrication may be better.
Absolutely.
Yeah, great.
And I tell my clients, after I send them to the gynecologist, for all those things, I tell them the same thing. The other thing I mention to people is, and I don't know if you ever have used this technique, besides an internal massage with the vibrator prior to intercourse, making sure you're very aroused, you have lots of foreplay. Those little medicine syringes that we used to give our kids, some of us, or that you can buy them for more expensive because they're called lubricant launchers, but you can also just buy oral syringes because they're a lot cheaper. You can I've told many clients, you can take some lubricant with the oral syringe and put it inside your vagina.
That's a great way to do it. We use vaginal applicators sometimes, same thing as you get with your yeast infection medicine. I sometimes tell people, take that thing apart, wash it really carefully in soap and water, let it dry, and keep it. That'll work great. Or, if that seems uncomfortable, you don't want to stop the sexual experience for that, you don't want to do that ahead of time, put a ton of lube all over him before it goes up in there. Just lube everything up. He won't mind.
Exactly. And there's so many different types of lubricants. That's a whole nother topic.
We could do a webinar on lubricants and vibrators. I'm seeing other topics come down the line. This is great. What about for women who are having a hard time with their partner explaining the menopause transition and how that's impacting. And like you said, if a male, from a male lens, potentially they're not understanding this either. They know, okay, aging may be happening, but if they don't know about menopause, they don't know about human or female physiology. Any talking points, Dr. Mintz, on how a woman could start that conversation?
Absolutely. So first of all, start it outside the bedroom when you're not in the middle of a sexual encounter. I call them kitchen table sex talks. They don't have to happen at the kitchen table, but it's a much better place than the bedroom. And, you know, use your best communication skills and, you know, start out with saying like, hey, you know, I really love you. I love having a sexual relationship with you. And I have to talk to you about something that's a little hard for me. Like give the lay of the land first and then say, you know, I am going through menopause and I've talked to my doctor. I went to a great webinar. I read some books. And what I've learned is that one of the changes in menopause, besides those hot flashes, maybe you've seen me have or not, is that my vaginal tissue changes. So I'm not going to be as ready and for intercourse without some extra preparation. Some more lubricants, some vibrators. I'm seeing a doctor, I'm working on this, but we're going to need to take this into account in our sex life. And I would love to educate you about this. I have this book, I have this pamphlet, I recorded this webinar. Like, here's some information so that you can hear this. Or, and if he's resistant, you can see a sex therapist or take him with you to see your gynecologist and let your gynecologist explain this as well. Hopefully,
and I just want to, I was going to add, you know, on Genev.com, we have a ton of phenomenal information in the form of blogs and podcasts and all sorts of things explaining the changes of menopause, what a woman's body goes through. And while they are written for women to understand their own bodies, they're also great for men to understand what women's bodies are going through. Mm-hmm. So definitely have them browse and pull down what you think would be useful.
Read it together. Talk about it.
Yeah, bringing conversation around this topic is so important within your relationship as well as, you know, broader, like we're doing here. One question that comes to mind is women who are in same-sex relationships and going through menopause, perhaps going through menopause at the same time. I have some clients who their spouse is older and have already gone through menopause. Now they're going through menopause. Any suggestions, Dr. Mintz, on those conversations and those relationships and maintaining their sexual health and function?
Well, I think the conversation is similar. Mm-hmm. You know, and just oops, it says my internet's unstable. I hope you can hear the rest of my sentence. You know, it's the same kind of thing, like talk about it. We're so uncomfortable talking about sex, but I really encourage people, take the plunge, talk about it like you would, where do we want to go to dinner? It's an important part of life. But in a same-sex relationship, the issues might be different. Mm-hmm. We do know that women in same-sex relationships have more orgasms than women in heterosexual relationships. Why? Because they don't revolve the whole thing around the penis. And penetration is only added when someone finds it pleasurable. It's not like we have to do this thing. So there may be less issues with pain in a lesbian relationship, because the pain is usually with penetration. On the other hand, if you want to continue to maintain your vaginal health, I mean, it's still good to use that vibrator and give yourself an internal massage and that kind of thing. But to me, it's very similar. How is it affecting you? How's it affecting you psychologically? How's it affecting your body image? How's it affecting your interest? And open it up for conversation.
I wanted to add one thing I always talk to with my patients who are in same-sex relationships is though, even though both of you may experience menopause, it does not mean you will experience it in the same way. Mm-hmm. And so where one partner may have no change in their sensation, no change in how they experience pleasure, the other partner may have significant changes. We can't predict because menopause affects every woman differently. And so don't be afraid to say, I know you did great with this, but I am struggling in this way. Can we work together to find a new way to have pleasure? And one of the biggest things that tends to come up for my same-sex partnered patients is decrease in sensation. It can be harder to reach orgasm, or they can feel like they're not as responsive as they used to be. And that's actually a normal change. You know, there's less blood flow, there's less, you know, the tissues can be a little less responsive. And that's one of the ways that vibrators can really enter a relationship and help, is to bring a little more stimulation or switch up your vibrator to something that's maybe a little more stimulating or a little more deeply stimulating. There's some clitoral stimulators on the market that suction onto the clitoris and stimulate very deeply instead of just relying on surface stimulation.
Such a good point. Yeah, don't assume that I love that point. Don't assume that your partner's having the same reaction as you are. I use that same analogy when I talk to two partners who both have a clitoris. Don't assume that your partner's clitoris likes to be stimulated the same way yours does, because they're all different. So it's the same thing, right? Just ask, talk about it.
Right. Stacy, I'm seeing a question that came up on Facebook about the safety of hormone replacement therapy. And I just want to quickly address it because I know this does come up a lot in our webinars. Mm-hmm. Hormone replacement therapy can mean many things. And when we're talking about vaginal issues in menopause, most often we're actually talking about vaginal estrogen and the use of local or topical estrogen, which has a very different safety profile than taking a systemic estrogen, which means taking a pill or putting on a patch. We don't typically give a pill or a patch if your only symptoms are vaginal, because those don't actually work very well for the vagina. You need to treat the vagina at the vagina. And most of the systems that we use for vaginal estrogen are ultra low dose, so very, very low dose and really not absorbed into the whole body. They're so low dose that actually many of the oncologists that I work with, because I see a lot of breast cancer patients, are fine with us using vaginal estrogen even after breast cancer, even if it's estrogen receptor positive, because they're so low dose, they're really just not absorbing into the body. So the risks are very different. This is a great conversation to have with your gynecologist or one of our gynecologists, because we're all very well versed in how to use these medications and what the safety of these medications is. There are rare people for whom they aren't a safe choice, and then we have some other options, but many, many women can actually use these medications safely.
Thanks for that clarification. That's also a question I get very often when the topic on HRT comes up. And related to that, does HRT help at all with sexual function? Can it help with libido? Can it help with improving the decreasing dryness, things that can help with sexual health and function for women during menopause?
So I'll give a quick medical perspective on that, and that is that hormone replacement can be very helpful in sexual function in menopause when pain has been an issue. Because if something is painful, you don't want to do it at all, ever. And so if we can solve that problem, then often we see a recovery of libido. That being said, there's also some level of systemic hormone that for some women has an impact on sex drive. It's not universal. Again, one of those areas where women are all very different, but some of us in our cycling years would feel a peak of sexual interest around the time of ovulation. And so when that peak goes away, sometimes it can be harder for women to understand their sexual cues. And so while we can add hormone back, it doesn't necessarily make women feel like they felt prior to menopause, because we're not doing it in a cyclic way. We're doing it sort of in a constant way. So we can solve the physical issues, but sex just changes with menopause, which is okay. You just need to learn to understand your body's new cues. And that's how I talk to patients. But I'm sure Dr. Mintz has many better recommendations than I do.
Well, I don't think I have many better recommendations. I'm very interested in your medical perspective, and I will disclose I am on vaginal estrogen, and it's been wonderful. It's been very, very, very helpful. Because I was one of those people who had painful penetration upon menopause. So I just want to give a kind of self-disclosing shout out that to see your gynecologist and talk about it. The other thing I would add to the conversation is about women's libido. And I feel like this is a piece of information that when I tell people, it's one of those like things that I wish the whole world knew, because it's true science, but people don't know it. And that is, you are a normal woman if the longer you're in a relationship, 1 to 4 years, the lower your sex drive is. That we often think, what's wrong with me? I have this great partner, I love him or her, but I have no interest in sex, like no interest the way our culture defines interest, like horny, basically. But what the research with humans and our closest relatives, in terms of animals, in terms of apes and babonos, etc., it happens to every species. Women actually, and there's some very interesting theories about this. There's a book by Wednesday Martin called Untrue, which she unpacks all the science. But the bottom line is we have to stop, again, comparing our libidos to what they were and to think something's wrong with us, and that there's something called receptive desire, and that women don't go from, as we age and as we get longer in a relationship, it doesn't go linear. I'm horny, I will have sex, I will have arousal, I will have an orgasm, then I'll be done. It's much more circular. And I tell people you can use receptive desire, the idea that I know it'll be good once it gets going if I take the time. I know I'll feel closer to my partner after. And it's like a car in the wintertime. It doesn't need to already have like a full tank of gas and be going down the highway to take a drive. You can warm it up. And that's why actually scheduled sexual encounters, I call them trysts because that's a little sexier word, and you can then get your mind ready for the encounter and get your vibrator, maybe read a little erotica, which has also been shown to increase desire. But please don't wait to feel horny to have sex to get horny.
One of the examples I often give my patients, which I may have stolen from you actually, is that having sex as you get further into a relationship is sort of like going to the gym. Nobody wants to go to the gym. But once you get to the gym, you enjoy it and you feel really good about it afterwards.
That's exactly right. And you would never go to the gym if you didn't carve out the time to do it. You don't just spontaneously find yourself at the gym.
No, especially right now.
Yeah, that's true.
Anything. But
that may actually relate to COVID more than we meant it to.
Yeah.
Yes.
Yeah, no, that might be a good point too, where right now where you might be home all the time and with that increased stress response and perhaps a decreased intercourse or sex right now, it is appropriate to schedule it, put it on the calendar or a calendar, whatever you're using, and plan ahead for that, especially when the days start running into one.
Yes, absolutely. Carve out the time for it. And it really works as for women as we age and our relationships age.
Excellent. Well, I'm going to put, as we finish up here in the next few minutes, I'm just going to put a call out for more questions from our Facebook group or anybody that's on Zoom. Put them in the chat box, the Q&A. We'd love to answer them. This is a topic like we've been talking about. There needs to be more conversation, so we'd love to hear your questions so that you're empowered with the knowledge on how to have more conversations like this on your own. So put that out there. And then Dr. Mintz, do you have any resources? Definitely your books, and we'll make sure to link to that when we send out our email of the recording of this. But any other resources, things that you recommend to your clients looking to support their sexual health and function?
I think we've talked about just about everything, right? see your gynecologist, read sex positive, accurate information, the blogs on your site, my book, have conversations, and go shopping. Go shopping online for some lubricant and a vibrator, and there's, have fun, enjoy. Yeah, but those are the big resources, right? For me.
One of the other things I often add for my patients is when you're looking for something to sort of get your juices running in terms of erotica, the erotica that men enjoy is not the erotica that women enjoy. A lot of porn is made for men. So it works for some women, and that's great. But there are increasing numbers of sites out there, whether they be apps with podcasts or books that are actually geared for women and that are written by women for women to stimulate women. And they approach sex from a very female perspective. So look for those things. They can be really helpful. And a lot of women respond much better to that.
Yeah, can I add one thing there, please?
Mm-hmm. Yeah.
That women are just to get that women are visually aroused. Like there's this myth that we're not, but we are, and we're aroused. So, but I put feminist porn in Google. You'll actually find some good stuff. A student of mine did a study. She compared my book, A Tired Woman's Guide to Passionate Sex, to an erotic fiction book. And she had women read it, and she took some sexual functioning indexes before and after and 6 weeks later, and both resulted in increased arousal, less pain, increased desires. So read if visual erotica is something you're like, oh, not for me, there's some great erotic stories out there as well.
Absolutely. And I often tell women, it may seem like reading erotica. Reading erotica is actually visual stimulation in my book. You're using your eyes to stimulate your brain. So I don't see any issue with reading it rather than necessarily watching it. And some women just find a podcast useful, but I totally agree. Women can absolutely be visually stimulated. It's just sometimes we are stimulated by different scenarios. Right. And I love feminist porn. It's great. There's some great groups doing that.
Some great resources. We do have someone that did comment that speaking of, how do you, different types of erotica, and they said that scheduled sex encounters allow for foreplay to start as soon as you wake up. So, you can just start that if you know that is going to be the plan for the day at some point in the day. That might help you in terms of that foreplay and getting ready, knowing that it's coming.
Absolutely.
So that's another piece. And we also had another question. If you have never tried, back to the hormone replacement therapy, if you've never tried hormone replacement, what should be the first step to get on them?
That's very easy. Go and talk to your doctor. This is not something you can get not without a prescription. It is a prescription medication. And I want to be very clear, you should really see a gynecologist. Some primary care doctors do a great job with this and are very interested in it and can be a great resource. So I'm not saying just gynecologists can do it. But if you're concerned, gynecologists will be able to do it. And it's a great resource to start with. I often tell women, there are lots and lots of fantastic FDA approved products on the market that do this in a great way. You do not need something compounded or, sold just for you. That's not how this works. We have safe products that we love to prescribe and your insurance will cover, and just come and see us. You can come and see us in person if you have a great gynecologist or a great family practitioner who does this, or you can come and see us online at genev.com.
Excellent. And
we do prescribe via that service. Just want to make that clear.
What's that, Rebecca?
I said we do prescribe hormones via genev.com if it's appropriate. I wanted to make that clear. We're not just a consult.
Yep. And that's, I think, a great place also to start. If you have questions and you want to I know a lot of clients that I will talk to, they'll ask questions about hormone replacement therapy, and where I will talk to them about general things. It's not my area of expertise. And I'll recommend just make an appointment and see what your options are. Talk to someone that can assess your symptoms, your health histories, and your primary concerns, and then be able to support that. And that can be with sexual function or other things related to menopause.
Yeah, and we want to talk about this with you. Even if you choose not to take any medication, that's fine. It doesn't bother us. I mean, we get nothing whether you take medication or not. We want you to be as healthy as you can be, and being healthy sexually is one of those health parameters that we want for you.
Excellent. Another question that came up, how should a woman who has experienced vaginal atrophy get back to having sex?
So I'm going to make one comment. We refer to vaginal atrophy, and it's the sort of the old style word for it. The newer style word is genitourinary syndrome of menopause, because it takes into account the whole spectrum of what can happen down there. So once you have managed those symptoms to a point where you feel comfortable, then often actually experimenting on your own with a vibrator or a dilator is the best way to get started, so you understand how those tissues feel before you're in a more high pressure situation of a partnered situation. And that's what I often recommend as a provider. I often will prescribe dilators up to the size of their partner. So they can feel comfortable on their own, that fits and it's comfortable and it's no longer uncomfortable. I'm sure Laurie has some hints to add to that as well.
No, I mean, that's exactly what I would have said. And, see your doctor, get the estrogen or whatever, and then work on your own first. And, you could also incorporate, an appointment with a pelvic floor physical therapist who can give you, some, like, a lot of time, the pain, tell me if I'm right, please, the pain a lot of time is at the entry of the vagina, and there's like a muscle here that also responds to estrogen and can get stiff. And you can also take your hands with lubricant or your vibrator with lubricant and really like massage, like you're giving yourself a massage, loosening that muscle up, which has tightened both from menopause and from the fact for some people that you've tried to have intercourse when it's painful and then it's clenched even further. So the only thing I would add is, a pelvic floor physical therapist, or get online. I'm guessing you might have some instructions on your site for that kind of internal massage with your hands with the vibrator as well, but work it on your own first.
Yeah, that's a great point. There's not only the muscle there, but the reason most of the pain is at that entrance is because that's where most of the nerve endings are. The top of the vagina is not as sensitive. It's right there where all the good stuff comes from, is also where it can hurt the most. So absolutely.
Thank you for clarifying that. That's so important. Yeah.
Great information there. And we did a podcast, I think it was back in January, with a physical therapist who specializes in pelvic floor therapy. So that is on our website, and we're actually going to be bringing her back on for some more podcasts and webinars down the line. So things to look forward to, but if that's something that of interest, we'll make sure to link to that in our in the follow-up, but anyone can go to our blogs in our Learn section for that as well. One other question here on the vaginal prescription of estrogen. So can we also do that and apply at the opening?
So we often use vaginal estrogen only at the opening for some women, but I would not use it with your vibrator or your dilator. Vaginal estrogen is a routine medication you use every week. Most women, when they're at their baseline dosing, it's 1 to 3 times a week. That's used separately then from when you are actually using the dilator, because it needs to be present all the time for the tissues to be strong and healthy and sort of well elastic and ready for intercourse. When you're using a vibrator or a dilator, I recommend you only use a safe lubricant that works with that toy. The other reason for that is not only do you need it to have the vaginal estrogen all the time, but you don't want to overdose yourself. If you're putting it on your vibrator and using it every day, then you're using vaginal estrogen every day, which is not the baseline prescriptive dose.
Great point to clarify there. So that's excellent. All right. Well, last call for questions here as we're finishing up. And as we're doing that, Dr. Dunsmore, so can you just give a little bit more insight on our telemedicine program? You mentioned that they can schedule online. What else do our OBGYN providers offer?
Absolutely, I'm happy to talk about that. So the panel of providers that we have, we're now in 48 states plus Washington, D.C. So almost at the 50-state solution, we're getting there.
We're getting there.
Our providers are full spectrum OBGYNs. So we have knowledge of women's health from basically teen years through all of menopause. Many of us are focused specifically in the menopausal time. And do only that now as a specialty. We can provide consultations on alternative therapies for menopausal symptoms, on health maintenance through the menopause, on what things to look out for in terms of your long-term health, as well as hormone replacement consultations and prescriptions, and talk about sexual function, vaginal estrogen. All of those things are within our purview, and we do it online. You know, obviously the things we can't do are an exam. Please do not show us anything via webcam. We do not want to do that. But we will also help you to find a provider near you if you need an exam or we feel like you need to be seen in person.
Excellent. Thank you for that. And Dr. Mintz, if anyone wants to get in touch with you or get hold of your books, how would they do that?
So my website is www.drlauriemintz, L-A-U-R-I-E, Mintz.com. And it has a contact form that I will respond to. Professional ethics prevent me from giving, I have to say this, like I can't give individual sexual advice over email to someone who's not my client, but I certainly can answer very general questions about where to get resources. And you can get my books on Amazon or anywhere books are sold. And there's links to that on my website as well as the research that's been conducted on my books.
Excellent. Well, thank you both so much for your insight. I think this was a great topic for us to bring more conversation to, and hopefully we can all do that just by talking about things like menopause and sexual health that are part of women's health that are natural and normal, and we need to bring more conversation to. So thank you so much for your time, and to our panelists today for your questions and tuning in. This is a free webinar. It will remain free. Please share with those who you think may be interested, and let's spread the word on sexual health and menopause for more women.
Thank you for having me on.
Thank you, Stacey.
Honored to work with you.
Thank you very much.